I teach at the University of Maryland as a clinical professor of emergency health services. I also function as an adjunct faculty for the Federal Emergency Management Agency in the United States. I have worked with the UN. I'm on the standing committee on stress with the United Nations under the Department of Safety and Security. I also teach at the Florida Institute of Technology. I teach a disaster psychology course there. I teach for Johns Hopkins University, so all of those things have come from a background in fire rescue services, and of course you have to add a little education on top of that, but I started off really as a firefighter paramedic. And so I started to think about how do I put a program together, so I came up with critical incident stress management. You know, many years ago, we'd only go to a doctor if you were sick. Now we go to doctors to try to help us stay healthy. Well, it's the same thing with the psychological end of things. Years ago, you would never go to a counselor. You'd be seen as weak or unusual. Now we go and work with those folks to help us have a healthy life plan. So what can be done as a preventative? For an organization, I think what's most important is they recognize the distress that could occur in the workplace, that they identify when that has happened to their personnel, so they have to do assessment of personnel. Then they have to have a plan. They have to have a program in place, a strategy. And those strategies are things that are going to be very, very important. And one of the pieces of the strategy, and the strategy should be a kind of a large picture, but one of the pieces of the strategy is to have a peer support program. We have found that people who speak with a fellow worker who has been trained to carefully listen do better in many cases than they do when they're sent off to a mental health professional. So we need well-trained peers, but they have to be guided by mental health professionals who believe and understand the program. So you have to have that program in place. And then another thing is, once you've intervened, you have several options. That person may get better or they may need more, and you have to be able to assess and refer if that's necessary. Citizen Work Positive Initiative was developed by two organizations. One is the State Claims Agency, and the other one is the CISM Network Ireland. They've done tremendous work putting this together. It's taken several years. It's put together on some of the very best programs that exist. It's incredibly important, and it will be a model. It will be a model for the worldwide community. However, being a model, that means it's taken steps to organize it. There are other resources that are looking at these same issues. The United Nations, the European Union, those are also looking at these things. So the whole goal is to build a program to keep healthy people healthy and functional people functional. That's really what it's all about. And the authors of the Work Positive program deserve a lot of credit, because it's taken a lot of years and a lot of time to put it together, and it's a very, very logistical and logical approach. People are thinking their way through it. They're getting good identification of the problems. They're getting a good identification of the actual events that happen to people. They're looking at risk analysis, and they're looking at developing a strategic intervention program along with follow-up when that's necessary. So it's a really solid program, and I congratulate the authors, and I think that it's been a tremendous piece of work.